A very good morning to everyone. Welcome to today's session on accidents and hope and child safety. To speak on the topic, today we would like to welcome Dr. Vedat Dash. He has done his MBBS, MS in General Surgery, and MCH in Pediatric Surgery. We welcome you, Doctor. You can now take over the session.
Hi, good morning, everyone. I'm Dr. Vedad. Thank you, Chatura, for this for the introduction. Today we are going to talk about child safety at home. So, our home is considered to be our safe place, our place where nobody and nothing can touch us. Unfortunately, our adult homes are not safe for our children. In fact, yearly 3.5 million accidents occur in the homes every year, and they lead to almost 2.2 mortalities in children, 2.2 thousand mortalities per year because of accidents. So it's very important for us to understand that our homes are not safe for our children and to take steps so that our children are protected and safe in our living place. So it basically involves three things. One is we have to find out what are the risks that are there for a child at our home. The second thing is what can we do to mitigate those risks. Third, and the most important thing is supervision. A child should always be supervised at home, whatever, whether he's playing or sleeping or eating or bathing. We have to keep an eye on them so that even simple things can lead to major accidents. And last but not the least, teaching our child about what is safe and what is not. So I'll take you through the common accidents and situations in home which can lead to problems. Most common things is falls. That means every child falls, and all of us have had many injuries growing up and have seen our children doing it. So how do we prevent falls, and how do we make it uh, more safer for our children and without restricting their growth? So first thing that we must be looking at is called as managing heights. Now, in an average home, there are many high places: the top of the shelf, the top of our table, if we have a high dresser. Okay, so it's very important that we identify that these are high places and restrict the access of a child to that place. That means, for example, we have a dresser and we have a stool which is nearby. So if they're very close, then our child can actually climb on the stool and go up on the dresser and then fall over. On an average, a height of about 1 to 1.5 meters is what is manageable, but anything higher than that needs to be protected. The second place common for falls is windows. Now, though most windows in India have got grills or meshes, but sometimes we have windows without them. So if that is the case, then again, furniture near the windows which can help our child to climb onto the windows has to be taken care. And also blinds. Blinds comes with long threads. Those threads have to be safely tied up beyond the reach of the child because it can sometimes go around the child's neck and cause strangulation. Another common thing, especially with our work from home environment and are wires. We have wires running from the sockets, strewn across the floor to our work area. We must be very careful because the children, while running, can trip on those wires. And sometimes small babies who are crawling can actually bite those wires and get electrocuted. So, wires or any loose curtains or loose carpets can cause tripping. So, those need to be properly secured. And then comes, we have bathroom mats, we have carpets which don't have anti-slip. So sometimes the child runs and stands, suddenly he'll slip and fall and hit his head. So we must be careful that our floor mats and our carpets all have anti-slip pads under them, and the floor is not wet. If there is water lying around, we need to really mop it up. These are all common sense things which somehow sometimes we miss, and we end up with a mishap. Here I want to talk about a very specific problem that we see, that is walkers. So when we have a 1 year old child, we tend to put the child on a walker and let them move around to help in walking. Actually, what happens with the walker is that it sort of helps the child build up a lot of momentum. This momentum the body is not designed to handle at that age. So if and when they fall hard and they get injured badly. Very bad injuries have come to me with big fractures and injuries to to the liver, to the spleen, because children just toppled off over a walker. The other thing is that when we stay in apartments, sometimes if the doors or windows, we have this glass balcony railings, the walker can actually build up enough momentum to break through. So the other thing about walkers is that it's actually known to delay walking. That means if a child is put on walker regularly, they will learn to walk independently at a later age as compared to those children who don't use walkers. So here I'd like to say that avoid walkers as much as possible. If at all you have to use it, it has to be under supervision and not more than 15-20 minutes in a day. And a very common thing with older children is that they get up in the night and they want to use the bathroom, but it is dark and they trip and fall. And usually everybody is sleeping and nobody will come to know. So it's a very good idea to actually install night lights. There are low intensity lights which will be always there in the hall and near the kitchen area, and also in the bedroom, so that the child can see if and when they wake up in the night. Here nowadays we when we have a child, we don't get what is called as kid friendly furniture in India. It's not as easily available, but there are small points that we need to look at in our home. One is corners. Children will slip and will fall, but if there's a sharp corner around, they will hit their eye or their head and then sustain a bad injury. So we get very simple corner protected silicone corner protectors on Amazon or Flipkart, and you can buy them and make sure that all the sharp corners are either turned away towards the wall or they are covered with this corner protectors. If we have furniture, if there is a furniture which is loose or which is not which is rickety or which is rocking, those furniture needs to be repaired, so that you should have sturdy furniture, because the kid will jump on the bed and the kid will jump on the sofa. They will climb it, and if it is not strong or sturdy, it will collapse and the wood can actually injure the child badly. These are two common and often overlooked fact in home care of the child. So, having, in spite of our best wishes and our best care, our child will fall and we will sustain an injury. So, what do you do? What do you do if your child falls? First thing is to go up and comfort your child and look for any obvious injuries. That means if you have any bump or bruise or swelling, then put a cold compress or an ice pack. Here, I want to tell you is that you don't put the ice directly on the skin; it causes burns. You have to cover the ice up in a thick towel and put the pack. What it will do is it will reduce the swelling, it will reduce the pain in that area. If your child wants to rest, you can allow the child to rest for some time, and but you have to observe your child closely for the next 24 hours for any unusual symptoms or behavior. So what are the danger signs? What are the red flag signs when you see that you should immediately take your child for any the doctor? Obvious one is if there's any big injury in the head or neck or anywhere you can see a lot of bleeding or injuries. It's obvious. Then you take your child immediately to the hospital. Apart from that, if your child is sleepy or difficult to wake up, child is unusually irritable and not consolable, if the child has vomiting especially more than once, if the child is complaining of headache, back pain, or pain in the neck, anywhere, if the pain is not, after a fall, the pain should slowly disappear. Anywhere, if the pain is not going down or if the pain is increasing, that is something to worry at, and you should immediately take your child. If you feel that your child is not able to focus his eyes on anything, or if there is any behavior or any symptom that is not usual, then you should immediately take your child to the hospital. Routinely, we have small cuts and wounds, so which don't require medical attention. But in, how do we manage these cuts and wounds? This is just basic first aid. First thing that you should do whenever your child has a wound that is bleeding is elevate the hand and the limb, or apply pressure to stop the bleeding. After 5 minutes or so, the wound will heal. the bleeding should stop. Then clean the wound thoroughly with soap and water, nicely, and dry it properly and apply any antiseptic ointment that you have at home. You can choose to apply a small mm, uh, dressing on the wound, and little bit of calpol or paracetamol for the pain can be given. Anything that requires more painkiller or the bleeding is not stopping or it's a big injury, then it's safer to bring the child to the hospital. I have a couple of questions here which I would address as I'm going through it. First is, what appliances are safe to use around children? So, to that, most appliances are safe to use around children, but as long as proper precautions are used. For example, let's say we are using a cooking microwave oven, then the microwave oven should not have edges which are rusted. The wire should not be frayed. The wiring should be well hidden. Okay, suppose we are using a clothes iron, then that we have to be careful that the iron table is high enough so that your child cannot reach, and again the sockets are intact and they're not here. So as and suppose you're using any other power tool, they're properly locked after uh, use, and they're not easily accessible to the child. As long as you follow the precautions, any appliance is safe, but you should be supervised and you should be careful that there are no frayed edges or damage to that. The second thing is, will the radio waves from baby monitoring devices harm my baby? Is another question. We are living in a world surrounded by radio waves, and there are studies that are going on about the possible long term effects, which have not yet proven anything. So, as of the current knowledge, we can't say that the radio waves from a baby monitoring device can harm the baby. They are relatively safe, and uh, and should be used because they help us in supervision. I have another question. What if my toddler is choking? I'll come to that when I'm talking about choking in a little bit of time. Now, the second common problem that occurs in our home is burns. So children can sustain burns in various situations, and there are certain things that we must keep in mind to prevent burns. First and foremost is to reduce body temperature, reduce the water temperature. What does that mean? That means if you're using geysers at home, if you are if you are using anything that requires heating, try to keep it at the minimum heat setting so that in case of an accident, the damage is not much. The second thing is to avoid hot spills. What that means is, when you're having tea or having anything that is hot liquid around, then try not to you carry your child at all. Okay, so don't hold your child and have tea, or don't hold your child and have soup. Try to keep your child separate, because it's very common that the tea spills on the child or the dal spills on the child, and they develop bad scars. You have to establish no zones. There has to be areas in your home, like the uh, kitchen, or the place where you do your ironing, which your child is strictly prohibited from entering. So, as long as you have strict no zones, you can use unsafe things, mm, uh, unsafe places. Before feeding your child, you have to test the food temperature. That means before taking the warm milk, or the tea, or the food which you're giving, it's better to take a little bite or a sip, so that you know that it is safe for your child. Now with COVID, a lot of parents are giving steam inhalations and things like that, which has resulted in bad burns. We have managed a few cases. So my advice is, always try and use a vaporizer instead of a steamer. A vaporizer uses cooled mist and it does not cause any burns. And if you have any electrical cords or sockets near the ground, then it's better to plug them. We get commercially available socket plugs, or if you don't get them, just buy 3-pin plugs and plug it in without connecting any wire. And as far as possible, better to use clothing on a child instead of synthetics, which can easily catch fire. So I have another question, which is baby proofing the home better when both me and my wife are busy parents? The thing here is that baby proofing of your home is better even if you and your wife are not busy parents, because even with 24/7 supervision, a child manages to enter into potentially dangerous situations. So when you are having a baby or expecting a child, you should baby proof the home. That includes blocking all the sockets that are near the ground floor, and putting up meshes near the railings of the staircase or the balcony, and putting all the blinds, the threads of the blinds away from the reach of the child, and in case you are using any drapes in your kitchen, removing them off, and things like that. There are a lot of articles on baby proofing homes and stepwise approach, and I advise that every child home with a child should be baby proofed. I have another question. Is it okay for my dog to play with my toddler? Yes. uh, a dog, it will usually be very careful around your child, and they don't usually cause any harm to the kid. So dogs, if it's a member of your family, it's okay to play with the toddler. But yes, if you're addressing other pet dogs from other side, then from another family, then you have to be careful, because that dog will not recognize the child as a part of family and can have any protected things. So I have another question. How can I keep my child safe in a pool or at a lake? So one, at a pool or a lake, you have to be very focused on your child to see that the child does not drown or does not have any accidents. It is better to have a trained lifeguard or a swim instructor around, so that they know how to manage. If that is not there, at least one of the family members should know how to swim and how to help a child in drowning. So should that happen? Now, another question: what should I look for in a daycare to ensure my baby or child will be safe? First and foremost, is the daycare person well trained? Is the daycare person having a certificate in basic child care, first aid, and all those things? Then you have to go and look at it from a home perspective. Are there sharp edges? Are there places where a child's hand can get stuck? That means, are the corners well covered? Are the windows grilled? And so the biggest protection is itself supervision, as I said. So you have to look at the daycare persons who are looking after, are they well trained and qualified for that thing. So coming back to burns, so how to manage basic burns? So it is a very simple thing. First is to reduce exposure. That means whatever is it, take away the source. If it's in hot water, take it away. If it's something on hot, then move your hand away. Remove all clothes and jewelry that the child is wearing, because they can hold temperature for a long time. And then put your child's burn part under normal tap water. Don't put it under ice water, because ice will further aggravate. It has to be cool water, not cold water. And do it for at least 15 minutes, long after the pain has stopped. After that, you can gently apply some ointment in that. If it's a small area, any burn that is larger than a 10 rupee coin size needs to be shown to a doctor, because it can get infected and can cause further problems. If you're going to take time till you reach the medical care facility, it is better to cover it with a soft cloth or a cling wrap. That will help in preventing further infection from the burn. Rule of thumb is, if there is blisters, don't burst the blisters. They will act as natural dressing. And don't go for any turmeric or toothpaste application on the burns, because they can actually cause infections. Better to go for simple neosporin or sofamycin cream, which is available over the counter. You can give a single dose of paracetamol if your child, if the pain is too much, it's going to help your child. Apart from that, no other medication needs to be given. So another very common but dangerous situation that we face is foreign bodies, foreign body aspiration or ingestion. So now, what is a foreign body? Foreign body is anything that should not be eaten or cannot be digested. If that the child swallows, it's called as foreign body ingestion, and if the child chokes on it, it is called as foreign body aspiration. Now, foreign bodies are very common and are usually very life-threatening for a child. So, what are the common foreign bodies that we encounter? So, in my 8 years as a pediatric surgeon, I have encountered commonly from peanuts to magnets to earrings to chocolates, anything that is small enough to be swallowed, the child will swallow it. So how what happens if you swallow a foreign body? most of the 90% of the foreign bodies that you swallow will go into the stomach and will pass through without any problems. But if it has got sharp edges, it can cause holes in the stomach. If it has got if it is poisonous, it can cause poisoning. It can foreign bodies at times can cause blockage in the intestine. The child will not be able to eat anymore, will have vomiting, and it can lead to serious problem. Sometimes foreign bodies can migrate from the intestine into other organs. More importantly, is what happens if the child chokes on a foreign body. It can stop the breathing and sometimes cause coughing and pneumonia and things like that. And more acutely, if it's a big one, it can completely stop prevent the child from breathing. Here I come to that. What to do if your child is choking? So suddenly, at any point of time, if you feel that your child is choking or has swallowed something, is having a coughing, it's better to put your child immediately into the tummy position. That is a prone position. Put the child on the tummy and give firm pats on the back about 5 times. That is usually enough to dislodge any major foreign body and it will come out. If not, then immediately take your child to the emergency where we will be able to take it out for you. So, what to do to prevent foreign body ingestion? First and foremost is we should not give anything that requires chewing till your child's back teeth come up. That's about 2 to 2.5 years of age. Before the back teeth come, the child cannot grind. So small bits of peanuts, small almonds, they are all potential foreign bodies. So they have to be nicely crushed and given to the child. Second is small objects like jewelry, like toys which has got small ball bearings or Legos. They have to be kept out of reach of child till the child is at least 5 years old. Because one, less than 5 years old, the child tends to put everything in their mouth to test it, and the airways are small; they get blocked very easily. All medicines, all house cleaning, they should not leave phenyl or any household detergent lying around. All chemicals have to be kept under lock and key in the home, because the child can be curious and try to taste some of this and can cause serious problems. A very common thing with our modern lifestyle is a proliferation of battery operated devices, from the TV remote to our remote control games to our lighters. So many things are there which are battery operated. Now most of these things operate on what are called as button batteries, which are very attractive coin shaped batteries which children love to put in their mouths. I don't know why, but they do. So these batteries are a cause of serious concern, because even if they're swallowed, they open up and cause burns inside the child's body. So first thing is that try and look for devices which have got a screw so that the battery compartment cannot be easily opened. Or if it is not like that, if it's just a clip, then it's better to apply tape and secure the battery compartment so that the child is not able to open it. The another thing is the quality of the toys. If you're buying toys, make sure that they don't break into small pieces or have sharp edges. So what are the dangerous foreign bodies which if you have a doubt or suspicion, you should take your child immediately to the hospital. First is medicine. Any kind of medicine, if your child has taken, then you have to immediately take the child to the hospital. Any chemical, any magnets, because magnets tend to stick with each other inside the body and cause serious problems. Batteries and sharp objects. If any one of these five things are there, then it's better to take your child immediately to the hospital. And it is a good idea to take a similar object with you so that the doctor can see exactly what it is, or if it's a chemical or a medicine which the child has swallowed, to take the strip or the bottle with you so that the doctor can actually see and anticipate what symptoms the child might be expected to have. So uh, so these are basic things. So first is that we are looking at falls, and we're looking at burns, and we're looking at foreign bodies. They're the most common problems that we face in children, and they're the most common issues that we need to address. So I'm open for any questions that you have uh, based on this, any doubts or any things that you want to talk to me about. So as we're waiting for the questions, I would like to give a brief summary or take-home points for today's Facebook Live. First is baby-proof your home. Even if you have an older child, it's always a good idea to baby-proof. Second is ensure round-the-clock supervision for your child. Hot objects too should be kept safe, and make sure that you don't have small objects lying around if you have a small child. Take care of these four basic things, and you will have a safe and happy parenthood for your child. Thank you so much for today. That will be all.